This episode of Healthy Home Hacks is sponsored by the Building Biology Institute. To learn more about creating indoor environments that support health and wellness, visit their free resources at buildingbiologyinstitute.org.
How would you like to improve your health and keep your family safe? You're listening to the Healthy Home Hacks podcast, where we firmly believe enjoying optimal health shouldn't be a luxury. Healthy Home Authorities and husband and wife team Ron and Lisa will help you create a home environment that will level up your health. It's time to hear from the experts. Listen in on honest conversations and gain the best tips and advice. If you're ready to dive in and improve your well-being and increase your energy, you're in the right place. All right, here are your hosts, Baubiologists, authors, media darlings, vicarious vegans, and avocado aficionados, Ron and Lisa Beres.
We can't talk to two educated physicians today without bringing up the pink elephant in the room, the current coronavirus pandemic. You can't go anywhere today without having a conversation about the spread, the restrictions, the lockdowns, the mandated masks, and the fear surrounding this unprecedented time in our world today. But rather than a waiter, your mother, or your BFF giving you faulty information, our guests today are going to clear the COVID-19 clutter. Dr. Justyna Sanders is a California-based medical doctor and medical lifestyle transformation specialist. Dr. Justyna is the CEO and founder of PrescriptionLifestyle.com, whose objective is to promote health, wellness, and prevention by using whole, plant-based nutrition as medicine and unifying evidence-based disciplines of medicine into one system. She encourages the use of personalized medicine with a focus on whole body health and the underlying causes of disease, and she reveres lifestyle as medicine. Dr. Victor Sanders is a licensed California-based physician who is board certified in internal medicine and specializes in hospital medicine. Dr. Victor attended St. George's University School of Medicine and completed his residency in internal medicine at the University of Arizona. He is currently working at Hoag Hospital in Newport Beach, California. Dr. Victor has worked closely with hospital-based dietitians to revamp their patient menu and provide healthy vegan options. OMG, I'm like, love that. As the lead physician for the inpatient diabetes management team, he's collaborated with diabetic nurse educators to improve the treatment of diabetes in hospitalized patients. Dr. Victor educates his patients and the public on the benefits of a whole food, plant-based lifestyle. Welcome both of you to the show. Woohoo!
Thanks for having us.
Thank you so much.
Let's dive into it. So, what risk factors are associated with contracting COVID-19 and are worsening the symptoms or outcomes of that?
So there's various different risk factors, and everything that we're going to talk about today is evidence-based, and everything that we talk about basically on our platforms with patients, with my clients and other people is all evidence-based, and it's found in the medical literature. So what we're finding is that cardiovascular diseases, as well as people who have kidney diseases, chronic respiratory diseases such as COPD or asthma, these are major risk factors, as well as obesity and hypertension. So we're finding that anyone with this, whether it's comorbidities, a mix of all of these, some of these, or even one of these, puts them at greater risk for contracting COVID-19, and also puts them at greater risk for having more severe manifestations of the illness and infection itself, and the long-term consequences of that.
Go ahead, Dr. Victor.
Other risk factors, obviously, we've heard a lot about people's age, so advanced age. And that comes with the older you are, people in society tend to have more of these chronic medical conditions that she just mentioned, as well as diabetes, type 2 diabetes, hypertension, heart disease. These all kind of come in one package. So your risks, if you have one of these, your risk of getting the others are greater as well. And what we've seen is that these risk factors increase your chance of death by a factor of 12. Factor of 12. That's
wow.
Massive. And just by having one of these, as opposed to multiple, one gives you a risk factor increase by 6. And this is coming out of the CDC's Morbidity and Mortality Weekly Report as of about last week. So this is some of the most current data that we're finding.
I did read in a Forbes article just recently that also too, 42% of US deaths are coming from a very small population, 0.6% of the population, specifically maybe around nursing homes and those areas. And that kind of is in alignment with what you're talking about with age. Yeah. Did you read that by chance as well, or want to comment on that?
I did not read that, but I can give you some information about like Orange County, where we have, half of the nursing homes out here are now reporting outbreaks. There's about 70 in Orange County. So that's up from about 20 1 to 2 weeks ago. So we're seeing the spike out here. And obviously we're seeing a greater amount of mortality coming from patients who are in these facilities because they're obviously older and have much more chronic medical conditions as well. So we are still seeing the deaths in that subset of population who are older.
And Dr. Justyna, can you repeat those risk factors again, just like name the however many there were?
Sure. So there's cardiovascular risk factors, kidney disease, we have hypertension, obesity, type 2 diabetes. Also, if you're pregnant, you're more likely to contract it. You have a 5% greater risk of contracting it. Oh, wow. And so various different comorbidities.
Wow. That's a lot of the population that you just mentioned.
Yes,
that's an interesting question.
Especially because a lot of people don't really realize that so many people have heart disease. In fact, children as young as 10, we've seen on autopsies have these fatty streaks in the aortas. So those are signs already of heart disease. And a lot of people don't know that it's linked to the standard American diet. So if we just think of it in a broad sense, it would make sense that most of us are at risk.
Right. Wow. And that's the standard American diet, which a lot of people also call the SAD, SAD, because it is a SAD diet. So would you say like that fatty arteries, whatever you called it, the fatty streaks, could you be thin, but on a poor diet and have that?
Yes, absolutely.
Yeah. Okay. So that's really interesting because I think a lot of people think that, oh, well, if they're not heavy, but they're eating a lot of fast food and fried foods, right? They think, oh, I'm okay. I'm not overweight. I'm not going to have risks for things.
Exactly. Yeah. So most times we're seeing, of course, someone who's obese have other things, metabolic problems, such as type 2 diabetes and other cardiovascular types of diseases, like we were talking about. But just because you're skinny does not mean you can't contract type 2 diabetes or any other disease such as heart disease.
Mm-hmm. Skinny fat. I've heard that term, skinny fat, right?
Now, does it mean too in the pregnancy? That really perked my interest as far as does the baby, is there any research? Maybe it's too early to tell. Do they get COVID as well? Or can the mother have COVID and not give it to the child?
So that has been a concern. I have not seen any hard and fast research that shows there is a risk of contraction, because if you think back into reproduction, the blood supply of the baby is not linked directly or commingles with the blood supply of the mom. Oh. So they're two separate things, because if they were together, the body would recognize the baby as like a foreign body or an invader and would go after the fetus and attack it. So the blood supplies are separate. So we don't yet know if there is any crossover of the virus crossing over from the maternal to the fetal circulation. Could there be a risk? Sure. But we don't have that hard data yet.
But we have seen reports that infants who are born can and have contracted COVID.
I just heard today 3 triplets were born with COVID.
Wow.
Yeah. And I don't know if the mother had it, but I thought that was so bizarre.
That's interesting.
Yeah. Well, so everybody's worried about contracting the virus today. All of us are. But are there any known residual or lasting effects after being diagnosed with COVID-19?
So I think before we answer that, it's really important to note that it's seen so far in the literature that around 80% of cases, so people who do contract it, will be mild to moderate. But what that means exactly, we don't know, because moderate cases we've seen can and have had really bad outcomes.
Yeah, so 80% are going to fully recover from symptoms or from the infection. Obviously, you're going to have people who are asymptomatic, didn't even know it. Then you're going to have people who are really, really sick. And so you're looking at 20% of the people who are infected with it stand the risk of having some long-term effects. So obviously, you're seeing long-term residual damage to the lung. So your ability to exchange oxygen and carbon dioxide. I've actually had patients who have had physically lung tissue missing on CAT scans of their chest. There's holes where lung tissue used. Wow. The only thing that's ever known to do that, to actually destroy lung tissue, that we see a lot in people is emphysema from smoking. But they're missing tissue. So your oxygen diffusing capacity is reduced. And so you could have, rapid decline in lung function surviving this. And a lot of people with severe disease who get intubated on a mechanical ventilator or breathing machine, they'll be on there for 3 to 4 weeks. So if you're in a bed, you're not moving. So your muscle mass is going.
Yeah.
You're chemically sedated, chemically induced coma from the medications we have to give. Because otherwise, if you were awake with a tube in your mouth, you would be fighting it the entire time. So you have to knock them out. Coming out of that, you have ICU delirium, cognitive impairment, on top of a critical illness myopathy where you're so weak, you have to relearn how to walk.
Wow. Oh my gosh. So, and they're not eating food, right? Are they just on IV at that point?
Well, you can do a couple different ways of nutrition when someone's critically ill, not able to swallow. The first off is a nasal gastric tube. So a small tube put through the nose into the stomach.
No, thank you.
Yeah, you're basically getting tube feed solution, which is basically artificial nutrition created from a pharmaceutical company. The other is TPN, or we call total parental nutrition, is nutrition given through the IV into your vein. Completely different formulation. Now you're not using your gut, which, as we've known, if you don't use it, you lose it in terms of gut, and you start having integrity of the gut wall breakdown and translocation of bacteria, increasing risk of other superimposed infections.
And your immune system is vulnerable at that point because it affects your microbiome and everything else. And since we know the microbiome, which is 100 trillion bacteria that live in your gut lining, which are responsible for the integrity of your immune system, now on top of it, you're going to even have potentially a further decline in your health because now you're affecting that at that level.
Wow. You don't even think about the gut when you think of somebody, in that sort of sedated state for that long. Like when you said, if you don't use it, you lose it. I never knew that. So it's actually healthy to eat as long as you're eating healthy.
The nasal gastric tube is not a long-term solution because you increase risk of sinusitis and erosion of your esophagus and nasal mucosa. So now you have to put a surgically implanted gastrostomy tube, what we call a G tube, which is a tube going from the outside of your body into your stomach where your tube feeds go. So now you continue to use your gut.
Oh, wow. Jeez Louise.
Well, that's obviously a very small percentage of people that are experiencing that.
Correct.
Right?
What did you say? 20%? Because 80% will recover. Yeah. That's the good news for our listeners. I mean, that's actually good news here. And then what was the percentage of people that end up on a ventilator? Based
on different studies and different outcomes and different centers that are reporting, you're looking at sometimes, I think an average about 40% of seriously ill people go on a ventilator.
Oh, wow. That's pretty high. Yeah. So your goal is to not get on a ventilator. It sounds
correct.
Like. Yeah. Correct. That's like, would you call that the last resort?
Yeah. Like if we have to do it, these people are declining and really quick, they go downhill fast. And so if you have any question, you have to put a tube in them, breathing tube into them.
I guess question about that too, when you're on a ventilator. Now, I've heard mixed stories where do they have to sometimes have restraints on their hands and that sort of thing where they're having a ventilator in place? Is that true, or is that just abnormal story that we've heard in the news?
No, that's true. We try not to use it because you're chemically sedated. And so we want to make sure you're adequately sedated via the medications. And so we don't want to put restraints on someone if we don't have to. But there's sometimes when people don't respond to a typical amount of sedation, and we have to put restraints because even when you're out, your body will just kind of move on its own. And you don't want it to grab a hold of the tube, pull it out. You don't want it to grab a hold of IVs.
It's very dangerous.
And you don't want to have the person cause trauma to themselves when they don't know what's going on or pull out catheters and things like that. So you have to, a lot of times you do have to restrain them just with their wrists. We try to just do the wrists only.
And can people visit the patients now, like in the hospital that you work at, Hoag Hospital? Can they have visitors, or is that still...
Well, we do have restrictions in place, but there are instances where we make exceptions. So the instance that we have is if someone's undergoing surgery, they can have one family member with them on the day of surgery. Oh. If there's someone who are not of a mental capacity to make decisions for themselves, children are another reason, or now we're allowing people who are dying to have a family member come in.
Oh, that's good.
Yeah, but for the most part,
everybody needs that.
For the most part, we're turning a lot of people away, or meeting them downstairs if they need to bring something in for that patient. We'll have a runner go downstairs to the front desk, pick it up from the family member and take it to the patient.
Oh my goodness. Wow. What a different world we live in suddenly.
Yeah.
I know it's a really extreme case. So someone is on a ventilator, but like what percentage of those who are on a ventilator even get off a ventilator? And how can you tell if they're strong enough, if they're actually sedated and restrained, that there's progress made, that they can be off the ventilator?
Yeah, to evaluate someone coming off of a ventilator takes an intensive care physician, what we call an intensivist. They are managing, at my hospital, they manage these patients. And so there's a whole, what we call a weaning protocol, where we try, once we think we've got a handle on someone's condition that caused them to be intubated in the first place, if their labs are looking better, their blood gases, which look at the amount of oxygen, carbon dioxide, and the acid-base balance, if those are all looking good, and we feel like someone's improving, we slowly turn down the amount of support that the machine provides. So let's say, as we're, room air oxygen saturation is about 21%. So on a ventilator, we can give someone 100% oxygen. So pure oxygen, but we can do any range of that. So over time, we want to decrease that amount of oxygen. There's different modes in the ventilator, some that completely take over the function of the lungs altogether, and the machine just gives air and takes it out. And there's other instances where it requires the person to initiate the breath, and then the machine just kind of gives them a little push to help them.
What is that called? I think we had a relative was that the CPAP or something?
No, CPAP is completely different. CPAP is the mask that goes around the face.
Okay.
And that's called continuous positive airway pressure. The ventilator has many modes, like pressure support, ventilator support. I don't know all of them in particular because I don't need to manage those, and that's done with the intensivist and the respiratory therapist. But there are ways to allow the patient to test to see if the patient can take a deep breath on their own, how much tidal volume or the amount of oxygen they inhale in one breath they can bring in on their own. So you do that gradually over time. And on these weaning trials, if they keep failing these, they have to stay on the ventilator. And over time, if they don't come off the ventilator, you're putting a tracheostomy.
Oh.
So that way you can then get this person, get that out of their mouth, start getting that, heal up, because that's more of the long-term thing is through a trach when someone's recovering for months and months, you need the support of a ventilator.
And that's major surgery, right? To get a trach?
It is definitely a surgical procedure. It's not that invasive. We can typically do it at the bedside in the ICU. There's just like a cardiothoracic surgeon that does it, makes a small incision, and it's pretty straightforward and pretty quick procedure.
Oh, okay.
But the effects on the patient.
You want to do that? Yeah.
You don't want to get to that.
It's still invasive.
Oh my God. And the ventilator, I guess it's just a tube that goes down your throat. Can they talk when they're on a ventilator?
No. You are completely in a medical
Ron, we would not do well.
That's why advanced directives and code status and designating someone as a decision maker are so crucial, because if you have no one to make decisions on your behalf, it falls to the next person in your family. So a lot of people don't have these discussions with their significant others or partners or family to say, here's what I would want done for me if I'm on a ventilator for a month. And so you need to have these discussions, these advanced directives and discussions with families, like, here's what I would want you to do for me, and designate someone as making decisions, because once you're on a ventilator, you're not going to remember it.
But this is an important point too, to make, that not just because of COVID, but in general, it's important to discuss these and have these kind of conversations with your family, because you never know if you're going to get into an accident or anything like that. And it's,
we had a tragic event in our family, and something happened with my brother-in-law and wife. And he was telling us that too. He didn't have an advance directive, and it ended up causing some issues with not being able to access some of her medical records that had to be on file. And he had said to us, you guys make sure you have one. And it's interesting because these are conversations that, you're not having with your family, and you're not being taught this in school or, so I think the taboo of, is something going to happen? Are you going to get sick? Like, we have to kind of just have those conversations and make sure that we have those things in place. Now, an advance directive, do you get that through a notary, or could you actually, if you just wrote something and signed it, would that be legitimate enough, or does it have to be through a hospital protocol?
In the hospital setting, we can take a verbal. If you come in and you're having a hard time breathing, you're really sick, you're like, I want her. She'll be my wife. She'll be making my decision. That's all. As your physician, that's all I need. Because if there's no advance directive in place, then you go to the person who knows you the best, and typically that's your partner. that's a family member, and someone has to step up. And so you can download forms off the internet for like durable power of attorney, for advanced directives. They do need a notary for those forms, because they're much more in depth of like, when you die, what do you want done? Very detailed. In a hospital emergency setting, you just tell me who to talk to and I will touch base. I will make sure that person is informed and get decisions made from that person.
For preparedness, just do it ahead of time.
Yeah, absolutely.
Because you're under a lot of stress at that point, no matter what, that's the last thing you need is more.
And it's the last thing you want to do is like, if you haven't had the discussion and someone's super sick and you're contemplating end of life care, is to feel like you made that decision to remove your loved one from care versus they made the call and paperwork months ago and you're simply executing their wishes.
And then the trauma that you have to, or some people do endure from making such a decision for the rest of their lives. I mean, that's too much for somebody. So
yeah. I'm always shocked in life how much we know about reality TV and sports and so little about some of these important things, our health and
most definitely. And it comes down to education, right? And these kind of conversations to really get you the information that you need and maybe stir curiosity for you to go do your own research, but to really make those decisions that are those pivotal decisions in your life that could save your life. Yeah. I mean, that's where you should be educated.
We need to talk about death. It's a whole process. Dying is a whole process in itself.
And it shouldn't be about fear mongering, but rather empowerment that, hey, like we all know that this is a transient time. We're not going to be here forever. And let's just, squeeze all the lemon juice out of the lemon, make the most out of it and do it in an educated, well-informed way.
That's well said. Well said.
Great point. I know we were talking about some of the extreme cases of the ventilators, but are there any treatments at this point that could help with treating COVID-19? And for example, like what are your thoughts on hydrochloroquine, zinc, and maybe the Z-Pack combo on helping patients either in beginning stages or later stages recover from this?
Sure. So just letting your listeners know, as of right now, there's no FDA approved treatment for COVID. What we have been using is an off-label use of medications already out in the market, trying to see if they would have some effect on it. And so hydroxychloroquine or chloroquine, remdesivir, convalescent plasma, and then you mentioned the azithromycin, or we call Z-Pack. I have personally been involved in the care of patients who have received all of these modalities of treatment. Currently, hydroxychloroquine has been pulled by the FDA to no longer be allowed to urgent use, and that was due to too many cardiac arrhythmias. There's a cardiac toxicity, if you will, with that drug. And when you combine it with azithromycin, it amplifies it. It's what we call a prolonged QTC. Basically, you get abnormal heart rhythm, you go into arrhythmia, and your heart can stop. So they remove that. Oh, wow. Remdesivir has been as a 10-day trial for patients who are very severely sick. So you can only get this if you're in a hospital setting. There has the trial that's been done looked at 1,063 patients over a 10-day course of getting this medication and found that it decreased your recovery time from 15 to 11 days. So about 31% increase. And the recovery was deemed as someone who's able to be discharged out of the hospital or return to their normal activities of life prior to. So that was a significant improvement. It has less negative effects too than hydroxychloroquine. So right now, my hospital has just finished the trial end of May for doing a lot of patients with that. And so we've been using all these things, convalescent plasma, basically giving the plasma of someone who's recovered from the virus and therefore has antibodies to someone who's acutely infected with it. I haven't seen a lot of data on the efficacy of that treatment, but it's still something that we're able to use. One of the more recent things that have come out of the UK is using a low-dose steroid called dexamethasone in patients, a very small subset, the very sick who are needing supplemental oxygen. So you need oxygen through either another device like nasal cannula, CPAP, or on a ventilator, and severely sick. That trial data is being done now through the National Health Service and Oxford University. They're looking at 2,100 patients versus 4,300 patients who get usual care. So that is the study. So they're showing some promising results. And so we can use it on an emergency use basis only in the hospital, but it's not something I recommend anyone going to their doctor right now and getting, because we don't want to use up the supply that we might need for people in the hospital.
Excellent. Right, yeah. Well, there certainly has been a lot of press on hydrochloroquine, but more specifically, combined with zinc. And I thought that some of the studies that were out there didn't have that combination with zinc and also as Z-Pack combo. Is that true? Or were there studies specifically on those combination of drugs together?
What I've been finding is actually with zinc in particular, yes, I have not seen many studies where zinc is used in conjunction with hydroxychloroquine, which is interesting because 25% approximately, at least it's estimated so, that of the US population is zinc deficient. So if you're using hydroxychloroquine, the whole mechanism of action is to allow zinc to enter the cell much easier, so intracellularly. And zinc acts in a way to actually go into the replicase, which is this thing we call the RNA-dependent RNA polymerase. This is the replication stage of the virus, a coronavirus or other types of viruses, respiratory viruses we've seen in MERS and SARS. And what it does is it basically targets that and attacks that. And that's what zinc does. But if we have so many people who are deficient, either not absorbing it or not getting it through their diet, most likely, right? Like we're back to that, the whole lifestyle thing, then if you're giving them hydroxychloroquine, theoretically it would make sense that that drug wouldn't be as effective because you need the zinc in order to go in and do its part.
Right.
We have used zinc in the hospital with hydroxychloroquine.
So he has with his patients, but we don't know, and I haven't really seen in the research them using those both in conjunction in all the different studies with hydroxychloroquine. I personally haven't seen
I want to
that.
say with the trials in the hospital, you did not need zinc. It was not part of the study trial. I think they were just trying to see if the drug on its own would work in combo or without the combination of azithromycin or the Z-Pack. But the cardiotoxic effects and arrhythmias were too great to continue, so it's been pulled from emergency use by the FDA.
But what's really interesting on the topic of zinc is these things that we call zinc ionophores. And these are channels that are formed on top of a cell membrane. And zinc ionophores, if you give something to somebody where it can create this type of channel for zinc to be better optimized, so to be able to enter into the cell and do its thing and attack the replication stage, that would be really beneficial. And so they're finding with remdesivir as a zinc ionophore, this has that sort of effect. But again, I'll bring it back. If someone is deficient in zinc or they're not getting enough zinc in their diets, and you do not store zinc in your body. So sure, it's found in skeletal muscle and whatnot, but once you use it up on a daily basis, you need to replenish it the very next day. So it's not like vitamin B12, for instance, that you store in the liver for up to 3 to 5 years. Once you have enough stores, you're good for 3 to 5 years just in case, but we in the whole food plant-based movement always recommend B12 anyway. But zinc is one of those things that you don't store. And so every single day you need a dose of zinc from your diet.
Wow. I didn't realize that. You need to actually, okay, so that's interesting.
We're going to get into that. Don't store it. We're going to get into foods, but tell us really quick what some foods high in zinc that we could do ingest every day.
Seeds, you guys, seeds. I don't know. A lot of people don't know this, but like pumpkin seeds and hemp seeds, so all different types of seeds, they actually have more per percentile of zinc than beef does. So for instance, 100 grams of beef has 44% of your daily value of zinc, whereas just 30 grams of seeds, any kind of seeds, has approximately 40%. So if you multiply 90 grams of seeds has over 100% of your daily intake of zinc.
That's great.
Oh, yes, yay. The vegans are. So we have all vegans on the call today.
Including the producer too, by the way.
Yeah, even awesome. The producer. Yeah. Even the producer.
Anything less from you guys?
So that's really okay. So great. You know, it's funny. I don't do enough seeds, so now I've got my warning. Could you supplement still if you can't get it in your diet every day? I mean, do you recommend a supplement?
You can most definitely supplement. 2 things I have a problem with supplements. Number 1, the adulteration. You don't know what you're getting. It has to be a reputable source. I always ask and encourage people to look at the certificates of analyses of the products, but nobody does that. Nobody does.
Do they give you the look like, what are you talking about?
Yeah.
The what?
But you want to know what is in the supplement that you're taking. Unfortunately, because they are not FDA regulated, the supplement industry, you can pretty much find anything in supplements and people will buy it. So
gotcha.
That's the tricky thing. And another thing with supplements is that zinc binds copper. So having too much zinc in your diet, especially from a supplement, which is usually high potency, high dose, you have a risk of binding copper. Therefore, you won't be absorbing copper, and copper is important for other biochemical reactions. So it's about that, the balance. And
yes, it's always
the
a balance,
best way, I always say the best way to know your levels, if of anything, is to go to the doctor and get a comprehensive testing of all the vitamins, minerals, and cofactors and enzymes and everything that you have. But no one does that either.
I was going to say that we go to a functional integrative center and an integrative MD, and they are very aggressive with the testing, although your insurance company doesn't cover like a lot of that. So your bill, you're always a little shocked when you get the bill. Like, what happened to my insurance? Oh yeah, they paid for $20 of it. No, some are better than others. But so you do have to, that's a really great point. You do have to kind of speak up, be your own proponent of your health and say, hey, I want you to test more than just the basic that's going to be covered. Yeah. And I know a lot of people, are budgeting and worried about that, but it is an investment in your health. It is an investment to get those full panels done, right?
Absolutely.
Every year.
And I always say, challenge your doctor. A lot of them haven't had the education that you might have had, or the exposure that you might have had with nutrition and all the things that are starting to come out about how, you can reverse chronic diseases. It's, you don't have to be on medications for the rest of your life. And many of these doctors who maybe A, don't stay on top of the research, or B, just haven't had the exposure, just haven't had that, that kind of education, challenge them, bring these up with them. And they might think you're a hypochondriac at one point, but who cares? You're your own, the CEO of your health. Yeah. You're the greatest health advocate for yourself. So, and you got one life, and you gotta live it. So
right. And not just live it, but live it well. Right. Exactly. I mean, I know we all on the call here agree with that. It's not just about kind of surviving through this. It's about thriving. That's been my big turning point is, I was really sick when I got sick from the toxins in a new home. And, you can fall into this slippery slope of, well, I'm just getting by, and I'm doing this, and I'm just getting by. And, no, that's not a life. Like, you need to thrive, and you need to feel good, and you need to have energy to do all the things.
It's not about a lifespan. It's about a health span.
Oh, I love that. It's not about a lifespan. It's about a health span. Love it. Tagline. Okay. So what can people do? I know everybody listening is saying, hey, well, okay, this is all great, but what can I do right now to prevent COVID-19? And assuming they should take the Ron earthquake strap proactive measures with their health.
That'd be the Ron's approach would be a hazmat suit.
Exactly.
There you go. We're all safe.
We're all safe. Exactly. I think what we are hearing out there and what people are basically not adhering to, we need to adhere to it. The obvious, hygiene being the biggest thing, as well as the masking, not touching your face, don't touch your eyes, washing your hands, common surfaces. What are you touching that other people have touched? And the social distancing. We know how this thing is transmitted. We can do simple measures to prevent that.
So one thing I want to bring up is a lot of people don't know this, but one of the number one preventive measures for basically preventing infectious diseases in all of history we've seen is none other than soap. It's hygiene, it's public health measures. So it's not the advancements in technology that have actually created longer lifespans, or I'm not talking about health spans, but lifespans, the longevity. It's actually hygiene, sanitation. These are the measures that we've seen in history that have actually helped allow humans to live much longer. So I can't tell you how many times, and I don't know if you guys have seen this, but over the last 6-7 years, I've been saying, I have not seen one person in public wash their hands properly. Where's the 23 seconds? Where's the soap? I see 5 seconds. I see no soap. I see just fingertips. It's no wonder. And I'm all about, having a healthy microbiome and exposing yourself to dirt and getting in the garden and stuff. This is talking about like fecal matter transmitting, diseases.
I want someone else's microbiome.
That's right.
Yeah, no, I don't want a fecal implant. I've heard about those. No.
Transplant. Yeah, Ron would be your donor. So.
Oh, wow.
No. I know they help
It'd
people.
Be clean. It'd be clean. That's for sure.
You're right. Dr. Justyna, that's such a good point. We did a show on homemade hand sanitizers and what's in hand sanitizers. And we have articles on our website that, everyone's just going hand sanitizer crazy. And like you said, just the soap with the good 20-second wash, scrubbing in between.
Lisa, she said 23 seconds.
Oh, okay.
It's 20 to 23.
Is it okay?
Seconds is great. Get that 20 seconds, but happy birthday.
Happy birthday. The ABCs sing, and then also I think a lot of people don't realize that a lot of the hand sanitizers on the market, yes, they have that 70% alcohol, but they also have a lot of additives like synthetic fragrances that can have endocrine disrupting chemicals in there, and they can have thickeners and a lot of other things that can be toxic. They're also extremely drying, right? So when you get your cracked skin, you're more susceptible to catching all kinds of things. So yeah, I love that. Just good old fashioned.
Yeah, you bring up a very good point about the adulteration and methanol. We're seeing studies of people having methanol in so many of these newer products. I mean, that's toxic. What are you doing? And that's not what we're talking about here. We're talking about health. So
yeah, we talked to a chemist who said, hey, if you're in the worst case scenario, just use alcohol, rubbing alcohol of 70%, just plain. Ron and I bought a hand sanitizer at the store, and everything was gone from the shelves. So we just took whatever we could get. And this hand sanitizer is kind of, we put it in the car as like a backup at the gas station or whatever. It smells so disgusting. It smells like tequila, and it's called like Bahama Breeze or something.
You got a worm? Is there a worm in there?
Yeah, exactly. A worm at the bottom. It like nauseates me. I don't use it, but Ryan uses it sometimes. I'm like, I'm suddenly craving a margarita. Oh, it's the hand sanitizer. It's so gross. That company was happy to still be in business, I guess.
People are buying up Everclear. When the sanitizer was wiped, they were going to liquor stores and buying Everclear bottles because I think they're 160 proof.
Yes,
80%.
Right.
Making their own from Everclear.
Which brings us to the point of how bad is our healthcare system and how ill-equipped are we?
Yeah.
For these kinds of situations. I mean, shouldn't we have been prepared?
Yeah. Why didn't we learn these things from the beginning? Right. So this show's so important because I know we're going to get into, more of the immune system and that kind of stuff and what we can do just in our everyday life and really being proactive and taking responsibility, right? Taking responsibility for your health. And, Ron and I have been teaching people about getting toxins out of their home and life so that your body burden load isn't so high. And, people tend to pay attention when they need to, when it's an emergency versus doing these things ahead of time.
Well, that's a great point. I want to ask you doctors exactly how does the immune system work? And before I ask you that too, I did have a quick thought. I was thinking, okay, we're all for social distancing and staying away from people, but let's say you're on a hike by yourself. Would you recommend wearing your mask? Because ultimately, from what I understand and what I've been reading, is when you're breathing out carbon dioxide, you're breathing it back in. And so that's not so good for your body, I would think, right? And you're not affecting anyone else but yourself. Mm-hmm. What would you suggest in those scenarios? I've seen a lot of people hiking and running and exerting a lot of energy and breathing in carbon dioxide from the mask they're wearing.
I mean, you could probably hypothesize that their carbon dioxide level might go up a little bit in their bloodstream, but these masks are designed so that the holes in them allow oxygen still to come through. So, and allows molecules to still exchange. It's all based on particle size of what they're allowing. So I wear a mask. As soon as I step foot out of my car onto hospital property, I'm in a mask. I only take it off when I eat or I'm sitting somewhere where I can shut the door and be by myself in like a small dictation room or something. So I'm wearing it all day. I haven't felt lightheaded. I haven't felt dizzy. I haven't seen anyone passing out, being hypoxic or having a low oxygen level. I haven't seen any of that. And, we're busy all day long in the hospital, physicians, nursing staff, cleaning crew, everyone, visitors, everyone's wearing a mask and you're not seeing it. You're not hearing about it. I don't think it's something to be concerned about. Now, if you're running or doing like a CrossFit workout with the mask on, I don't know how good that's going to be. I just don't know. Mm-hmm. I would say it's going to be harder to breathe. And so it might be like exercising at an elevated climb or elevation to kind of give yourself that edge in endurance sports. But I don't know what it's going to do to you in the meantime. I just
So
don't
in
know.
terms of studies or anything like that, we haven't seen anything in particular, but commonsensically, if you're in the middle of a forest by yourself, take the mask off. Like,
Sure. Yeah.
Please take right. And because we see a lot of people driving in their cars by themselves with their mask on. Maybe it's because they don't want to keep taking it on and off. But I don't know. At that point, I'm like, I think it'd be better to get some fresh oxygen.
Yeah, that's the only concern is, the concern of reinfecting yourself. So let's say you have viral particles on your mask, and let's say you're touching it with your hands, taking the mask off. Maybe now it's on your hands. Maybe when you put it back on, maybe you get the viral particles now inside the mask. There's just that concern. Again, the research, I don't know. I've not seen studies to show and definitively prove that, but that has been concerns that have been brought up by the World Health Organization, at least.
I've seen that. Yeah.
There were a couple of things. So one of the reasons why I asked you is there's some videos that were popular where someone was actually taking a reading while wearing the mask, an air reading on carbon dioxide, and the levels were considered pretty toxic, right? I don't know what the exact level was or what those examples were, but that was one example. And then the other one was, if someone had COVID already and they had it in their system, they were discovering that by them wearing a mask, they were actually breathing it in, and then COVID was going to their brain. Is that true?
That was New York. That was some New York hospitals, I think.
Yeah, was that? So since we have both doctors here, I just wanted to ask.
You might not know, and you might not be familiar with that.
I have not seen anything mentioning about like constantly staying infected because you're just rebreathing viral particles. And that meaning like a prolonged infectious period or what? I don't know.
But let's just say, Ron, if someone is positive COVID, we would kindly ask them to stay at home. Thank you.
Well, that's true. But let's say they're asymptomatic, right?
Yeah.
And so I was curious about that. Just wanted to get your opinion on that. But getting back to the immune system, which we all agree we have to make strong and basically optimize our immune system. How do we do that? And what exactly do you guys do?
We have two different types of immunity. So there's an innate immune system as well as an acquired immune system. So when you think of those two, an innate is basically what we're born with. It's in our genetic makeup. It's our natural killer cells. It's our macrophages, which are little scavengers. It's that type of immunity. Whereas our acquired immune system is a B T cell mediated immune system with antibodies. You keep hearing antibodies in the news with the herd immunity, and we'll touch on that. So this is what we acquire or build up over time based on our exposures, based on our lifestyle and things like that. So it's important to look at both. And when it comes to COVID, and actually when it comes to any kind of illness, infectious disease, you have to think about boosting versus optimizing the immune system. So what do you do, right? A lot of people are confused. Should we boost it, like make it so intense, like, fight for me all the time kind of thing? Or should we just optimize it? So what we're finding with COVID-19 is that depending on your baseline, I'm going to touch on this, but depending on your baseline, it's most likely better to optimize your immune system as opposed to boost your immune system, especially if you're positive for or have signs and symptoms for COVID. At that stage, you want to have an optimized immune system. Okay. The reason why is this whole concept.
Well, hey, can I stop you here? Optimized versus boosted. What exactly does that mean first? I don't know if our listeners understand that concept. At least I didn't.
Yeah, sure.
One of our listeners does not know.
Who is that person?
So optimizing your immune system is basically where all of your inflammatory mediators and your immune cells, your white cells are working in cohesion. All of your biochemical reactions are in check. Everything's working the way it's supposed to help you fight any pathogen that comes your way, any foreign invader. And your immune system should be able to fight that naturally. And so whether it's an innate or an acquired immunity, it's supposed to be able to fight any kind of pathogen. However, there are situations where, depending on your underlying cause or underlying condition, medical condition, so if you have heart disease, kidney disease, if you have type 2 diabetes, for instance, your immune system is much more sensitive, much more vulnerable now because it will not work in an optimal way. So it won't work as well as an immune system in someone who's completely healthy, who doesn't have an underlying medical condition, who isn't on any medications for anything. So when you compare those two people, one person has more of an optimized immune system that can work better for them, whereas another person, now their immune system has to work harder. So in that vulnerable system where maybe you have a medical condition or you're on a drug for a certain medical condition, you want to optimize your immune system. And in fact, in those people, you might want to boost it. So optimizing is where your immune system is just working, like I said, just in a natural state, normal state, the way it's supposed to. Boosting it is where you are lacking so much immunity because you're already so inflamed, so sick. Your immune system is just, not an overdrive, but your immune system is suppressed. And so now you have to compensate for that. So in order to do that, you have to possibly rev it up, boost it up. And there's so many things that you can do nutrition wise and lifestyle wise that can help to do and aid that.
That was a great explanation. So ultimately, we want to have optimized immune systems. We should. But if you're in a dire situation like these immunocompromised, then you need the boost.
Yes.
Did I sum that up good? Okay.
That's perfect.
And then, and some of these things would be, I'm guessing, your vitamins, your minerals, your food, and then like, would you recommend vitamin drips, the vitamin C and D and those kinds of things?
Yeah. So there's so many different things, and we'll bring it back to the zinc that we discussed earlier. So zinc as an essential mineral, in the seeds and nuts and beans, legumes, all that, you can get it from your nutrition. And so, this is something really important to incorporate into your lifestyle. Now, what helps zinc go in are zinc ionophores. So these channels. So we found that in the plant kingdom, in the plant world, these bioflavonoids called EGCG, which is epigallocatechate gallate.
I hope we don't have to repeat
Can you say that fast?
I hope there won't be a quiz at the end.
Epigallocatechate gallate. And so EGCG, that's found in green tea. Green tea acts as a zinc ionophore. So it allows basically zinc to go back into the cell intracellularly and act in the way it's supposed to. And when it comes to COVID, it's theoretical, of course, but it would make sense that having these zinc ionoforms such as EGCG from green tea and drinking green tea on a daily basis would allow these zinc ionoforms, these channels to form that will allow zinc to go into the cell and act in the way it's supposed to attack the replication stage of the COVID-19 infection. It theoretically makes sense. And we've seen that in research, at least in cell culture, that it has worked in that way. Another amazing bioflavonoid, aside from EGCG, is quercetin. And quercetin in the plant kingdom can be found in onions. So you guys get those onions in.
Oh, we do. We're onion people.
Superfoods such as watercress, you can find that in certain stores. Great source of chlorophyll too. A lot of people, right? And cilantro. So these are just like foods that some people might find at any grocery store type of thing. But yeah,
it's interesting. A lot of the foods you mentioned are prominent foods in like an Asian diet. Do Asian countries have lower numbers, I wonder, of COVID cases?
We don't know. They're not reporting correctly, maybe.
We don't know.
Yeah, we don't know. But that's interesting. I mean, so many of what you mentioned, like the green tea.
That's the problem.
That's the problem.
Let's get the numbers right, then we'll talk about zinc.
Yeah. So the green tea, I know years ago, it was all over the news about it being contaminated, some types of green tea. What is the thing that we want to avoid and look for with green tea? So was it metals? Was it contaminated with some kind of heavy metals?
Yeah, there's heavy metals in a lot of it. You're right, for sure. And so I always say, look at the certificate of analysis. And then if you don't, at least I say stick to loose green teas as opposed to the bags. I personally don't like a lot of the ones with the bags because of they leach chemicals as well. So the loose green teas, you're better off that way. Organic, you're so much better
bags, a lot of those new bags have plastics, right? They're like nanoplastics and they're... Oh my gosh, they're getting everywhere. Like they're permeating the oceans, but they're also so small.
You bring up a good point, because it's those bioplastics that people think, oh, well, these will disintegrate once, throw it in the trash. Well, they disintegrate into these micro little particles that you can't see, but it's still doing and wreaking havoc in the same way that,
and in your body.
Yes. And in your body.
Right? I mean, if it's disintegrating, it's going to be disintegrating in a hot cup of liquid, I would think.
And then it's affecting our soil, and then the soil is affecting our plants, and then it goes on and on with our microbiome. And
okay, so bringing back to antibodies, we just touched upon that a little bit. So if you contract COVID-19, does that mean that you have immunity to future exposures, and therefore you won't contract it again? And is there such thing as herd immunity? We've heard about this. I'd love your explanation, because all I know about it is you get it from vaccines. You can also get it naturally. I thought if enough people get it. So I'd love to hear your breakdown on that.
So we could talk about, we talk about antibodies first, and then we get into the herd immunity.
Okay.
Antibodies are now like a big hot topic when it comes to COVID, because now it's going to, right now, my hospital is also part of a trial of testing healthcare workers if they have antibodies or not. So I've been tested. I don't have them. I'm going to have another blood draw in a couple more weeks just to see. The question becomes not so much, it's a multiple part kind of approach you have to take. It is, one, do you have antibodies? And two, are they going to offer you any protective benefits? So just because you have antibodies does not make you immune to the virus. So if we're going to stick with COVID, and we've seen that just because you might get the virus too, you might not make antibodies even in that instance. A study came out about Sweden. We all know Sweden has sparked a lot of controversy by approaching the pandemic with herd immunity. Only 6% of the population has antibodies. So when it comes to herd immunity, you need a large proportion. We're talking 70% of your population to have antibodies. They have 6. It takes a while to get there. But before we digress into herd immunity, antibodies, hospitalized patients are more likely to have neutralizing antibodies. So by neutralizing, I mean that ones that can actually stop viral replication. So a recent study that just came out, I believe, in the past week or so from the journal Nature, looked at 111 patients out of New York. I think Rockefeller Hospitals. New York was the hotspot when it came to the U.S. Looked at 111 patients who were positive, and then looked at 46 asymptomatic household contacts of those people, and looking at who's got the antibodies, what does it mean, who's immune, who's not. And they found that 20 to 30% didn't make antibodies at a significant level above the asymptomatic contacts, which were the controls. So a third didn't have antibodies beyond what someone just living in the house who never had symptoms also had. They looked at, and they saw that 79% of the patients only had partial immunity. Now, it's only 111 people, so it's not a lot. It's not, the study's not very powerful. But it's our first glimpse into what the antibodies, what benefit do they offer, and what is their meaning. And so there's a point of the benchmark of looking at antibodies is a thing we call NT50, which is neutralizing titer 50, the amount of antibodies needed to decrease the replication of the virus by 50%. So only 80% of the people had partial immunity. So they had a little bit of it, but not above it. You want to get to like a titer of like thousands. Not very many people have single digits.
Wow. So partial immunity. So what exactly does that mean? Like you have some of the antibodies, but not enough to ever stop it from affecting you? Is that what you mean by partial?
You might contract the virus again for the second time.
Oh, I see.
This time, if you got really sick, then you could theorize that the second time around you might not get as sick.
Wow.
So it
might be beneficial.
Okay. Yeah. Are you pro a vaccine for this then? And if so, mass vaccination or more just, the immune compromised, or what was your thought on that?
I mean, I don't think there's it's a very complicated answer to be in this situation where we're creating a vaccine, we're fast tracking it. We're not going to have years to look at it and do multiple clinical trials to look at larger and larger patient populations to see what the long-term effects are on this. We're going to produce it, and someone is going to decide subjectively that this has some benefit, and then boom, they're going to mass produce it. And then people, I think, will rather take it take their chances than getting the COVID and possibly dying. We don't know the long-term effects, so we're treading on dangerous waters here, I think, by going after a mass vaccination of everybody.
Yeah.
Versus letting your body and your immune system be exposed to it, and what's going to happen. I mean, that's a big unknown for people too. So I think both are pretty big unknowns, and it's going to be difficult to say, is there one that offers more advantage and more benefits than the other?
Mm-hmm.
And what is the ultimate end goal here? Because if we're going towards a herd immunity, which several studies have thought that we need to get to 70, if not 80% immunity, meaning that much of the population. So we're looking at 200 plus million people in our country need to have antibodies either by way of vaccination or by getting the virus. But then, as we just mentioned, just because you get the virus doesn't mean you have appropriate level of immunity.
Mm-hmm.
And the people who die don't contribute to herd immunity.
Oh, right.
The thing about that too is that that's counted in the numbers of people who are tested positive.
Mm-hmm.
But if they're dead, they can't protect the rest of the people, right? Because herd immunity is you try to get the majority of a population immune to a disease so that you stop the spread, you stop the transmission.
Mm-hmm.
So you need to get 70% of people either mass vaccinated. Who knows how long that will take?
Yeah.
We could be into next year before we have a viable vaccine with no long-term data to go off of. Or you let 70% of the population get sick and you're having a mortality rate that is higher than influenza. It's not lower, it is higher.
I mean, it's going to be a difficult decision too. Like, what do you do if you do have a vaccine, finally available? Will you be first in line? Or do you wait it out and see what the effects are over time? I think, that another point that needs to be brought up and really discussed, and we should be having this conversation in the medical community and on the news right now, is what people can be doing right now to, again, strengthen the immune system, change our lifestyle, reverse chronic diseases. We need to be more aware of what we're doing on a daily basis, the cumulative actions that we basically have every single day on our body, the effect that every single action that you have in your lifestyle has on our human body. Mm-hmm. That's what we should be considering. How your diet is, how you're sleeping, are you exercising, who do you surround yourself with, what kind of toxic chemicals are lurking in every single thing that you expose yourself to on a daily basis, whether it's mold or plastic or something like that. These are the conversations we should be having now. And these are what I hope in a month, 2 months from now, are what we'll only be talking about, where we can finally say, hey, it's time for our healthcare system to wake up. It's time for people to wake up, take their health into their own hands, and it's time to transform.
Woohoo!
Wow, powerful. I felt that.
That was an award speech. That was great. You just don't see any news coverage on this. And it's unfortunate. And that's why, when like Ron and I and you and both of you are going and telling people, hey, it's really, really important that you clean up toxins out of your life. They're like, oh, well, if that was true, it'd be all over the news. It's just not. I mean, you really have to research and dig and understand. And you mentioned so many things that are so important that people don't think about: your sleep and even the people you surround yourself with, right? Your spiritual toxicity, right? The toxicity of conversations, the toxicity of like too much negativity, too much negative news, adding in meditation or prayer or whatever that is for you into your life, where you can quiet your mind and, heal yourself that way. And of course, electromagnetic radiation, which Ron and I, are very big proponents of. It's just, we live in such a wireless world, and all of these things are kind of now having these synergistic effects where everything's getting bombarded and our body is getting less and less time to heal and to calm down and recuperate. I don't know if you guys saw this, but Israel announced an antibody that neutralizes coronavirus even among those infected. I just happened to see that. I don't know too much about it, but I thought I'd throw it out there.
No, I'll take a look at it. I haven't seen that. Yeah. I mean, it seems like there's something every day that comes out about an antibody. Right. Even now there was, information coming out of China about people who have been infected, that their antibody titers are dropping off after 2 months.
Oh, their antibody, what is dropping?
The titers, basically the concentration of the antibodies in their bloodstream.
The study that came out a few days ago.
Yeah, we look at antibodies in terms of a titer amount. So when you get tested or get a booster, you need to boost up your antibody titers.
Right. And they're dropping quickly for some
reason? They're dropping. So we have no idea what a positive antibody test means in someone. To give them immunity, is it partial immunity? How long does it last? And versus, getting the infection versus a vaccine, same questions. Is the vaccine going to give you immunity? How long is it going to last?
What are the negative effects? How long will those last? Are they lasting?
You need a booster every 6 months for the rest of your life?
Yeah. At the end of the day, I love what you said. I know for me, I would not be first in line, but then again, I'm super, super proactive with my health. I think, if you had immunocompromised system, that's a different story. You're now weighing out the pros and cons, but it does seem to me that if you are healthy and you don't have those risk factors that you mentioned at the beginning of the show, it's risky. It's risky to go in and put yourself into a position where these untested vaccines haven't gone through animal trials and things like that.
The only concern and that we're seeing with COVID-19 specifically is this cytokine storm where the immune system goes into hyper-inflammatory type of state and reaction. And this is very unique to this kind of respiratory infection because in the typical coronavirus or rhinovirus or these are the types of viruses that we see in the common cold, we don't see something like a cytokine storm reaction where the immune system is like too robust, too strong. This is why I talked about the optimizing versus the robust. So in someone who's healthy, you might not want to just overdo something like, for instance, vitamin D3 supplementation and elderberry have been found that if you're already positive for COVID, those two things you might want to be wary of taking during the time of you having COVID or having the manifestations of COVID-19, because it could drive the immune system into hyper overdrive where you're releasing these chemicals, cytokines, chemokines, and your body's now destroying not just the infectious tissue, but also the healthy tissue and the integrity of that. And that we've seen and you've seen in the hospital, people really quickly decline if they do enter that type of state.
Wow.
What would be a high level of vitamin D? I mean, people take a supplement typically, or what would be something like, hey, don't do this because they may be asymptomatic and not know that they have COVID, but they're taking a lot of vitamin D. What would be that?
So if you're asymptomatic, you don't really have to worry, right? Then you can keep taking vitamin D3 because if you're asymptomatic and you don't have symptoms, but once you start seeing signs and symptoms, I would say, I personally, from the research that I've been seeing on vitamin D3 during the time where you have signs and symptoms of COVID, I would say just stop it for that time being.
I don't know if I'm going to say that right. Cytokines.
Yep.
Is that, I read something, we have a colleague who created the barefoot earthing pad. I don't know if you're familiar with that. It's that, earthing grounding, going back to that grounding. And he was saying that is really good at countering that, just the grounding and getting your feet on the earth. And if you can't do that, walking barefoot, obviously, if you can't do that, there's the pads and the grounding pads. Figured I'd throw that out there. Okay, so we got to wrap up, and I would love to have you guys back. This has been so incredible and so eye-opening. You guys are such a wealth of knowledge, and you're such a little power couple.
You are.
Yeah. I think that's why we meshed.
We meshed. We've dined together twice over very wonderful, vibrant, colorful, plant-based, organic, vegan food.
And that's so much fun. I can't wait till we can actually connect again in human touch, I
know, no mask, that'll be great.
Thanks for what you guys do. This is incredible. And you guys are the real deal too, because we were vegan, but we didn't realize there was different levels of vegan. You're a hardcore vegan. It was like you were avoiding oils and things like that too.
They made you and me look like rebels, Ron.
No.
Yeah, we were like rebels.
It was like, we eat oil. Oh, no. I'm just kidding.
Well, you're probably rebels in the household with all of your toxic-free everything.
Right. We challenge each other. I love that. And I love meeting people who do make you better and who inspire you, right, to do your best. So, the silver lining here, I think, is that people are, paying more attention, hopefully after this podcast, you've gotten some great tips from the doctors, Sanders, both of them, and that you implement a more plant-based movement. I know we're not going to have time to get into all of what that looks like, but maybe on another show, we could get into just the food and diet. And then what do you guys think the future looks like in terms of living with COVID? Will we get back to a new normal? Will we get to take those masks off and like get back to somewhat of a normal? Or do you think this is going to last for quite some time?
I think this will last for quite some time. And that could be that it's a topic in the news. It's on everyone's discussion. Every day numbers will be coming out. I think that's going to be for a while. I think what's happened is when we started to bend the curve and we went into lockdown, obviously the balance of coming out with the economic toll it was taking, you had to find some time to be like, we got to just take a chance. And I think the biggest thing was to let healthcare get ready to absorb the hit. So I think now we still have a lot of the population who went into lockdown, who are still wary of coming out. They're still going to be at risk of catching it because of everyone else. And so I think we're still going to have cases, at least for the remainder of the year, for sure, where we're still going to be having to practice the social distancing, the masks, and being mindful of where we go and who we are around and who we associate with and where do we go. We're going to have to be mindful of that. And I think that's something that we're going to have to be mindful of for, I think, forever. So if this is a virus that it's so new, we don't know what it's going to do. If it's just a one-time thing and done, or it's going to come around every year like the influenza and just be a different variety of H and N, we have no idea.
Yeah.
So it could be around. We've already seen it mutating. Who knows if those are going to be even stronger than the current strain or the more predominant strain that first came out? We have no idea. So I think we need to get used to what we're doing. Make this the mask, this distancing, the hygiene, number one, the hygiene.
Just soap, guys. Use soap.
Yeah.
This whole show could be summed up in one word: soap.
It's going to be part of your daily life. And, you're going to have a whole new economy in that we're bringing manufacturing jobs back to this U.S. because we saw that we relied on China for not only drugs, but for PPE. So if we can do it ourselves, we can create those jobs because a lot of jobs are forever lost.
And I think too, it also creates this sort of new lens to look at the world and has brought in a different perspective of, zoonotic diseases and how us as humans our relationship with planet Earth and Mother Nature and how we're impacting that, how we can basically in the future, if we continue our practices, we already know there's going to be even more devastating consequences. You think that this is bad, it's going to get even worse. We're seeing fires, we're seeing so many things, so much devastation, diseases. It's just going to keep happening. So I think this is a wake-up call for all of us as humans to take action, not only on an individual level, but action collectively in terms of humanity, and finally take a stance and say, no more, we're going to start changing things around, implementing more plants and doing things that we know are better for us, the health of us and the health of in humanity in general, and the health of Mother Earth and everything in it. So,
oh my gosh, so beautiful. That was beautifully said. Amen to that. I cannot agree more. Again, this was so fantastic, and people can learn more about you at prescriptionlifestyle.com. Well, thank you guys so much. I hope you enjoyed the show as much as we did. We appreciate you joining us today. You can learn more about us at ronandlisa.com, and be sure to tune in next week to find out what the heck is going on in your home.
This episode of the Healthy Home Hacks podcast has ended, but be sure to subscribe for more healthy living strategies and tactics to help you create the healthy home you've always dreamed of. And don't forget to rate and review so we can continue to bring you the best content. See you on the next episode.